Hello, viewer. My name is Betty Marimu, and I'm here today. We are on Health Talk, as usual, discussing a very important topic. This time, we're talking about infertility. I know for so sure that you want to be here to witness, to hear, to learn. There's a lot of information that you definitely want to know. I am joined by a guest who's going to be introducing himself to us for this particular show today. Welcome.
Good morning, everyone. Dr. Paul Koigi is my name. I am a consultant obstetrician and gynecologist and infertility specialist, and I'm happy to have the opportunity to be here with you today.
Wow. Thank you, Dr. Paul, and welcome to Health Talk at GBS TV. We are so glad to have you, especially that you're going to be teaching us lots of things. So let's pick this up from just here, infertility.
Mm-hmm.
When people hear about infertility, the basic thing is you cannot give birth or you cannot give seed.
Mm-hmm.
I don't know who is actually infertile because not the ability not to have children starts from the man, because the man is the one who gives seed. So the man could have the ability to give seed, but the woman is not able to carry, or the woman is able to carry, but the man is not able to give seed. There are those all things people say about infertility. Please tell us precisely what is infertility.
All right. Thank you, Betty.
Yeah.
So there are very many ways of referring to infertility, but from a medical standpoint, we consider a couple as having trouble conceiving if they have been together for at least a year, having sex at least 3 times a week, they are not on a method of contraception, so they're not trying to avoid pregnancy, and they have the intention to get pregnant.
Wow.
So if there's a desire for pregnancy, there is frequent, consistent sex, at least thrice a week.
And been together for
They've been together for at least a year. And they have the intention for pregnancy.
Okay.
And
so there's no birth control.
Yes.
So this thing people say, I've been here 6 months, na kuna kitu, that is not it. You cannot conclude so fast.
No, we don't consider it as being within 6 months, but from a medical standpoint, we say that if the couple has been having trouble getting pregnant for at least a year, then there's a problem.
Okay.
Because about 80 to 85% of couples who generally don't have any medical issues, within roughly a year, about 80% of them, if everything is in good working order, about 80% of them should be able to get pregnant. And if they don't get pregnant within that first year, then within the second year, another 10%. So up to 90% of people who are trying to get pregnant and trying to have a baby will usually be able to get pregnant within 2 years.
What is it with the consistency? Because there are people who are not even married. They will try just once and they will get pregnant.
Yes.
So what is it with the consistency? Why does it have to be years?
So basically, that has a lot to do with how fertilization occurs.
Okay.
So basically what happens is that for one to be able to conceive, you have to have a good quality sperm and a good quality egg. So the man can release about maybe 500 million or so sperms at contact at any one particular given time.
Yes.
But for the woman, she will usually release 1 egg per month. So the consistency of the timing is because not everybody understands how to plan for the timing of when the egg is released. So by having consistent sex at least 3 times a week, then there's a good chance that by the time the egg is released, then the sperm can be able to join with the egg while it is available.
Isn't the egg released during ovulation?
Yes.
And for the 500 million sperms that are released, not all of them get to that place. There is the speed of the traveling and whatnot. So when the egg is released during ovulation, which could be 1 or 2 or 3 days, okay, ovulation will happen once. But how long will the egg be there, and how long can the sperms wait? Or who has to wait for who?
So basically what happens is that when the man and the woman come together, they get intimate, and the man releases the sperms into the woman. The sperms start making a mad dash towards the egg.
Yes.
And the eggs and the sperm are generally attracted to one another. So the sperms will go in through the cervix, go up through the uterus, go in through the tubes towards the ovaries where the eggs are. And usually the egg and the sperm will join somewhere in the tube. So for that to happen, the egg, when it is released and it is only available for and functional for about
That time.
24 hours. So conception can only happen during a stretch of about 24 hours in a month. So for those who happen to have sex once and get pregnant, then
It was the timing.
it was the timing, or in that case, it was luck for those who did not intend to get pregnant.
Or such a mixed feeling and reaction over there, because somebody may not want to, but it is the timing that has made it happen. And so is one able to tell that right now, or in these 24 hours, the egg is going to be released, so I need to get to that guy?
Yes, that is actually very possible. So what normally happens is that after the period of having one's menses, then the eggs develop. And usually the one that is the best quality or during that period of that cycle will be what will end up being ovulated. So we have something called ovulation predictor kits.
Okay.
And that ovulation predictor kit uses basically urine based, so it's something that the woman can test at home. And what happens is that when there's a certain hormone called luteinizing hormone, when it shoots up in the body and it has that reaction on the test that shows that the luteinizing hormone level is high, then it means that within 24 hours she will ovulate. And that is the
day.
key point in time. Yes.
Okay.
Within that day.
That is for the woman.
Yes.
What would hinder? What would still make conception not to happen, even when the woman has prepared all this and she's so certain that today, in these 24 hours, it will happen if I just get? What would be the issue? Because there are blame games before we get to how the man and the woman who is infertile and whatnot. The woman has tested, has done the ovulation, used the ovulation test and has confirmed. What is the guarantee that when she gets intimate and receives the sperm, she will actually have conception?
Well, on average, there are no guarantees.
Okay.
And the reason why there are no guarantees is because what happens is that, fine, you may have been able to predict that she is ovulating within the next 24 hours. But ovulation is not the only thing that is responsible for conception.
Okay.
There are factors within the man and there are factors within the woman. If you look at the man, there has to be the ability to deliver the sperms into the lady, which means the man must be able to attain and maintain an erection. He needs to be able to get together with the woman. He needs to be able to deliver the sperms to the proper place.
The sperms will come out during an ejaculation.
Yes. So he needs to ejaculate in the proper place.
What do you mean?
There are people who suffer from premature ejaculation. If it's all out before it gets to where it's supposed to be, then it won't go where it's supposed to go.
So once the man is in, it could still go to the wrong place?
No, this is before getting in.
Oh,
yes.
Okay.
And on top of that, then, you're talking about ejaculation.
Yes.
Ejaculation happening is not a guarantee that there are good workable sperms inside there.
Yes.
Because if there's damage within the testes, or if there's a problem between in the relationship of the hormones,
Yes.
or between the man and his brain and the hormones and the testicles, and they fail to produce sufficient good quality and good numbers of sperms that are able to move the right way towards the egg, then even if they are sperms, they may not necessarily be able to function the way they should.
So it is not just about the counts.
No.
It is also about the psychological.
Yes.
So if he could have the counts, but if he is stressed, or what the woman would call the happy hormones, it will still not happen. The sperms understand that language of the body, and they will get stressed and not do what they need to do.
Not quite. I think the real concern is about the ability to deliver them.
Okay.
For the
Which
man.
requires what?
So, which requires that, yes, of course, if he is stressed, then the
Okay.
ability to attain and maintain the erection can be compromised.
Okay.
Yes. But once they are delivered, if they have sufficient good number and good quality, then they can be
So
able to
number
go.
is 500 million, but I think only a few are needed.
Technically, only one
One,
will actually, you will usually be able to fertilize.
fertilize.
Unless you have multiple eggs being fertilized, then you can
Yes.
have several.
Yes.
But
The quality
yes, the quality of the sperms,
will,
the
the
number of the
quality
sperms.
would be, what is it that will determine the quality? Would it be the food? What exactly? Because this person is now not stressed. They are mentally stable, emotionally balanced. The count is there. What is this that is going to affect the quality?
Okay, so I think we've jumped across quite a number of issues.
Yes.
So I think if we're talking about the issues that cause men to have trouble delivering good quality sperms into the female, there are quite a few. So
Okay.
lifestyle factors are a very important one, because problems like smoking, the chemicals in the cigarette smoke directly adversely affect the ability of the sperms to the testicles to produce good quality sperms. Then alcohol that can directly damage the blood vessels that go to the testes, the blood vessels that go to the penis, can also damage the ability of the brain to produce the necessary hormones in order to support the production of the sperms.
Okay.
And of course, there are other things like insufficient good quality nutrients. And then there are also other habits, like, for instance, wearing very tight-fitting undergarments is not good for a man, because the testes need to be at a lower average temperature than the rest of the body in order for sperms to have a good environment in which to be produced effectively. But if that gets compromised because the guy is wearing very tight-fitting underwear, then that can be directly compromised. We also have a few social habits that don't really help. For instance, the habit of going to steam baths and saunas very frequently. It means that not only is the body temperature relatively high in relation to the area around the testicles, but the entire surrounding environment is extremely high. So if you're consistently putting a man in a space where he's in a steam bath or he's in a sauna and the temperature is like 60, 70 degrees, and you keep him there for 30, 40, 50 minutes, then you're not helping his ability to produce good quality sperms. Yes.
So you could go for sauna, but not as frequent.
I'll try to avoid them as much as possible.
Oh, really?
Yes, because rather than saying reduce the opportunities to experience damage, if you can eliminate them as much as possible, sure. But of course, with our socialization now, people want those things and we view them as luxury habits. So if you may not be able to entirely eliminate it, then maybe go for them as infrequently as possible. Yeah.
Wow, that was so comprehensive. The reason I asked you that is because I wanted to get exactly what would hinder conception when everything else was right.
Yes.
And you are here, you know, other than the consistency.
Yes.
There are people who would say they have tried a whole month, 2 months, you know, but sperms is, the egg is there just once in a month. So it justifies the fact that you got to be there at least frequently. But there are those people who also have all this put together, but still something is amiss.
Yes.
So before we would go into something further, it was important for them to have a closure to actually get that I could be ready and set, but the problem is on the other side.
Yes.
What exactly causes infertility?
So actually, we've by talking about what happens in the man, we've actually talked about the causes of infertility in the man.
Yes. So for the woman.
Now, on the woman's side, there are very many things that can happen. Now, if we look at the ability to conceive and the ability to carry a pregnancy, if you look at the reproductive system, you start off with the ovaries, and then you have the tubes, and then you have the uterus. Now, within that uterus, we have the wall of the uterus,
Yes.
and then we have the lining of the uterus.
Okay.
Now, for a woman to be able to conceive, now, over and above the sperms being delivered to the right place, at the right time, in the right number, functioning the right way,
Good quality.
with good enough quality. Now, on the woman's side, you need to have the ovaries releasing good quality eggs consistently.
What?
Number one. Number two, the most common problem that makes it difficult for women to be able to conceive even when everything else is in order is when you have problems within the tubes. And the tubes tend to be damaged typically by infections. And these infections, the most common ones are chlamydia and gonorrhea. And another one which is a little bit more common in the underprivileged settings because of overcrowding and because of poverty is tuberculosis. Those are three of the more common ones. And when you get to the uterus,
I'm wondering how tuberculosis would come to the tubes.
you know, once tuberculosis gets inside, if it gets in through the lungs, typically it can get in through contact, it can get in by being swallowed, and it can get in by being breathed.
Yeah,
and
it's
once it gets
communal.
into tissues, it does not necessarily respect tissue boundaries. It can get in through any other space and go all over. So the tuberculosis can be in the tubes,
Okay.
it can be in the uterus, even in the man, it can be in the testicles, it can go to the intestines, it can go to the liver, the lungs, the kidneys, the brain, so on. So that's another story for another day.
Okay.
But so over and above the tubes being damaged, now for the wall of the uterus, you could have problems like adenomyosis, where you have the lining of the uterus being present in the muscle of the uterus and compromising the wall of the uterus. So it creates chemicals that do not support the uterus to be able to carry a pregnancy. And then you could also have problems like fibroids. Fibroids are extremely common. They are present in almost 70% plus of women. And most women are walking around with fibroids and they never know that they have the fibroids unless they start causing problems. Then after that, there is the lining of the uterus, which is the innermost portion, and that is the place where pregnancy attaches. Now, if there's a problem with the lining of the uterus because of infection that causes scarring, or because of problems in the ability of the lining of the uterus to accept pregnancy, what we call endometrial receptivity, then if that gets compromised, then it doesn't matter whatever else you've done. You can even have conceived, but if it can't attach, it'll be lost.
Wow.
So those are just...
So you may actually be able to conceive, but now you may end up with maybe a blighted ovum or a miscarriage or something.
Those are different. Those are different because, you know, by the time you're having a blighted ovum, you actually conceived and it attached.
Yes, so
Yes.
is it actually possible to
Yes.
conceive with these kinds of conditions or not at all?
You know, conceiving, by definition, is where you have a sperm
Fertilized?
and an egg come together.
Yes.
When they come together, they form what is called a zygote, which grows into an embryo and attaches on the lining of
The
the
uterus.
uterus. And then subsequently you want that to grow. And as it grows, it forms the baby on the one hand
Yeah.
and forms the placenta on the other, so that it attaches to the uterus, so that the mother can now sustain the baby. Yes.
So this inability to fertilize is what infertility is.
By definition, yes.
Is what infertility is.
Yes.
So these people who say they conceived but had a blighted ovum, they conceived but had a miscarriage, these people are not infertile.
Those are pregnancy losses.
So these people are not infertile.
Yes. You see, there's a difference between not being able to conceive versus being able to have
Losing.
a good quality conception.
Yeah.
This is why we keep on talking about the quality of the eggs and the,
the
quality of
quality
the
of the
sperms
sperm.
and the quality of the lining of the uterus.
Oh
So,
my God.
yes, so a lot of things have to come together and agree. So in terms of, this is one of the reasons why we keep on talking about something called the omelette principle. You've heard of the omelette principle?
No.
That if you're making an omelette, then the omelette is only as good as the eggs that you put into that omelette. Which is why we keep on emphasizing the need for good quality eggs and good quality sperms. Yes. So, and of course, the quality of the eggs and the quality of the sperm is affected by a lot of things, such as the chemicals that people are exposed to. You know, there are things, there are habits that we have socially that expose us to a lot of chemicals. And some of those chemicals are known as endocrine disrupting chemicals. They interfere with the ability of the body to produce or respond to the hormones in such a way that makes it favorable for you to be able to conceive. That happens both for the men and for the women. So for the men, some of the more common things are things like, it's also present for women, things like smoking cigarettes, doing shisha, weed, and alcohol in its various forms.
When they've had their babies, if they must.
Preferably.
Koigi, we need
Yes.
to take a very small break. And when we come back, let's talk about when the woman should now come to see you, or when the man should not now come to see you. After, I don't know after how long, when they have tried what. Viewer, let's take a short break. I'm here with Dr. Koigi. We're talking about what exactly causes infertility. What is this? How can we solve it? Is it even reversible? Stay with us. Welcome back, viewer. Dr. Koigi. Before we went on a break, we had spoken about what exactly infertility is. We have looked at what causes infertility in
Yes.
both men and women. And now people have the tendency to delay. They always think this month maybe I was not in the right mood, my happy hormones were whatnot, somebody was stressed, somebody was away. When do you think the woman should now come to you, or the man should now come to you as a specialist?
Thank you for that question. And to be honest, I don't think it should just be the woman or the man coming to look for help. And it's not that you wait for a certain amount of time. I honestly believe that if we want to have the best possible outcome and raise the chances of this couple being able to have their children, because a woman doesn't have a child, it's a couple that has a child.
Yes.
And the best possible thing that we can do is to have the couple come together immediately they feel that there is a problem. Because generally...
When would that be? Because you had, remember you had told us about a year of 3 times per week trying. Yes. When would that be?
So generally, if there has been no history of any previous problems, if the couple is under the age of 35, for both of them, and if everything else has otherwise been in good working condition, she has regular periods, and she's not had any history of having had any other problems. The man has not had any other history of having any other problems, and there is no known or suspected history of sexually transmitted infections and so on, that everything else is in good working order, then we can talk about immediately 1 year is over, and you've been trying and nothing is happening, please come. But if the couple is over 35, we don't want to waste time. There's a reason why that number 35 is important. We'll come to that in a little bit. But it is, I think, the key message to answer this question of yours is that it is vital that for better outcomes, for the best possible outcomes, we want the man and the woman to come together. And the problem that makes couples delay for so long is that we have got issues within the couple themselves, because the ability to agree to look for care, the ability to agree within the couple is actually a very serious problem. And if the couple is fighting among themselves, that they're having trouble getting pregnant, and they say, no, it's you, no, it's you, no, it's you, I'm getting my periods, I'm getting my erections, and I'm able to ejaculate, and I'm able to ovulate, and we're still not having a baby, and they're busy fighting back and forth like that, it wastes a lot of time. And conflict within the couple is a very big thing. In fact, it's probably the biggest factor, that if the couple can't agree to look for care, there's a problem. Secondly, we live in societies that insist that if you come together as a couple, we expect that within the next 1 year, maybe 2 years at the most, we are being kind to you as a society. If within that time, you should be able to have a child. If you don't have a child by then, then they even start saying, hizo ni shida za wamama.
Yeah.
And it's a problem because there's a lot of stigma that is placed on women.
Yes.
And the women usually bear the burden, the majority of the burden of failure to conceive. In fact, they look at it as failure rather than difficulty, and they blame the woman rather than saying, rather than letting the couple go through their own journey. Then even families and friends and the society come into the picture, and they complicate the issue further, because now they start saying, that woman is bad. You see, she's going to look at you badly, so you don't invite her for baby showers, don't invite her for visiting of babies, and if you are having somebody who is pregnant, don't bring them close to her, because she look at them badly and they lose the baby. So they stigmatization, and they start casting the woman aside. They call that ostracization. So stigmatization is saying that person is bad. Ostracization is saying don't go near that person. Unfortunately, that happens to women a lot. It's mostly women. And it happens not only within the social setting of friends and colleagues and so on, but the problem is that it happens even in families. And while it's happening within the family and within the social settings, the risk of gender-based violence in the form of intimate partner violence, that is drama that results in physical abuse, verbal abuse, emotional abuse because of difficulty in trying to conceive. The risk of that is raised by more than 30 times among couples who are having trouble conceiving. You see, like now we are in the middle of the world's 16 days of activism of 2023 to end violence against women and girls. And difficulty in conceiving is one of the biggest causes of intimate partner violence.
I wonder exactly how people are not able to resolve such matters, yet they're so intimate and so personal. They are not matters that should attract, third parties. And you have well answered why couples would delay seeking for help. You have also mentioned about time. Let's talk about the biological clock. It has been said that men would say even up to 100. I don't know how true that is. I know that women have menopause. I guess men have the andropause. And so how exactly does the biological clock affect or come into matters in fertility?
All right. Thank you for that question. That's a very important question, and it directly ties up to why the delay is important. Now, usually what happens, a woman will start with a fixed number of eggs. Before she is born, she will have around 2 million eggs. And that's up when she's still inside the uterus, before having been born. By the time she's born, that number has gone down to about 1.6 million. And after that, after she has been born, by the time we reach the point where puberty is beginning and she starts ovulating, then we have around 40,000. Because, in the woman's system, it's about what is effective and efficient. So the number goes down, and by the time she is starting puberty, she will have around 40,000.
From 2 million?
So, yes.
Jesus.
And it's all about the number and the quality. So it's the best ones that make it to that point. And then, even after that, it's only one which is released every cycle. Several of them undergo something called recruitment, where we say, hire. It's like a class of students. So you say, this is the class, and you have like 20 or 30 or 40 of them. And then they're all given a chance to grow because they're responding to the hormones. And the one that is the best quality among those ones is the one that is released. So by the time that is happening...
TMI.
No, but it is true. So, and we want to raise awareness so that we make it possible for people to be empowered to make the right choices and to seek help early enough. So when you have the woman releasing the eggs every month, she will usually end up ovulating around 400 of them.
Okay.
And out of those 400, assuming that it is ovulating once every month regularly, then it is 400 divided by 12 gives you about 33 years or so. So if she has her periods coming when she's 13, when she clocks puberty, then menopause will be somewhere between 45 and 50. And that's how that mathematics of the biological clock works. Now, because we know that by the time she's approaching 45, 50, we know that the number and the quality of eggs is really down. There is actually a very sharp point at which that decline becomes very much defined. It's very sharp, and that is the age of 35. At the age of 35, we have the number and the quality of the eggs starting to very seriously dip, which is why if a couple is having trouble conceiving, if they're younger than 35, then we want to try and offer them as much help as possible before they get to 35. If they are above the age of 35, then we need to offer them help immediately.
At least now the ladies know what they need to do.
Yes.
If they are delaying,
Yes.
they had better know what awaits them. Uko mbele. If they are still young, they don't need to waste their 20s. They could go to school and have their babies and have their families
Yes.
if they want to. So
Yes.
ladies, they should not waste their 20s at all.
Yes.
At 35, they already know what begins to happen. Let's talk about giving treatment. So people have discovered, they have come to you, you have told them, Nyinyi, this one, you cannot do this naturally. I have heard of people do IVF and stuff like that. I don't know what solutions there are for people who have already come to terms with this subject, infertility. They have known my husband's quality of sperms is not there. The numbers are not there. My eggs are, whatever it is. Whether it is the girl or the boy, they have already agreed that one of us or both of us have an issue. What happens?
So actually, that's a very good point you've raised, that it's actually the case that in 1 out of every 3 cases of people who are having trouble conceiving, the problem is with the woman. In 1 out of every 3 cases, the problem is the man alone. And in the remaining 1 out of the 3 cases, it is both of them that have a problem.
Okay.
So there are quite a number of treatment options available, and the treatment options directly depend on what causes it.
Okay.
Yes. But typically, if the problem is from the woman's side, that we have trouble getting her to ovulate consistently, then if the problem is because of failure to ovulate, but there are good numbers of eggs, then we can try to help her to ovulate.
Okay.
And
ovulation is not natural.
No, it's natural, but it is not guaranteed.
Okay.
Yes. And if there's a problem with the tubes being blocked, then it's not possible for her to conceive naturally, because the place where conception happens is lost.
Yes.
If the lining is compromised, then we can try to help to correct the problems within the lining of the uterus. If the uterus is not there, then we can persuade someone else to come and carry the pregnancy for her.
The surrogate mothers.
Yes, which we will come to.
Okay,
But,
I was just thinking,
for
Dr. Paul, that, I know you will correct those things medically or surgically, whichever way, but there is also this thing that people say that I wouldn't want to skip. People have mentioned the use of certain contraceptives to be the cause of, flushing out the lining or making it weaker, because there's this contraceptive called P2 that I guess you have advised should be used once or twice a year, and people abuse it. And other contraceptives that should not, I don't know about that, being not a medic, but people have also, later you hear, oh, you've married that girl, she was so rampant in using these kinds of contraceptives. So when you do, just know she will not get you babies. I don't know if that is a myth or there's truth in that.
Well, contraception is usually used to help somebody who is not desiring a pregnancy to avoid that pregnancy.
Yes.
And there are some methods of contraception which have what is called a long period to return to fertility. Now, for the P2s, we actually generally don't recommend their frequent use. We only recommend them in use as emergencies, not as something that is routine.
People would have emergencies every time.
Yes, but not the ones where they have planned
Okay.
the emergency
Okay.
of every Friday night. But they should actually get a more consistent method of contraception that is actually legitimately reliable, because that E2 pill can fail. Yes.
Yes. So
Yes,
would
the P2
that
pill.
be would that be a cause? Because people have victimized that. They have said for your many uses of the P2, this is now what has led you here. You have damaged your uterus or your tubes by use of this. Is that a myth or truth before we get back to where we were?
I can't commit to it being 100% truth.
Okay.
However, I can admit that the excessive use of the P2 pill can significantly increase the risk of having an ectopic pregnancy.
Ectopic.
Yes.
Okay.
Yes.
Okay.
So back to the other question.
Yes.
About the methods that are available
Yes.
to offer treatment
For infertility.
for infertility. We talked about some of the methods that can be used to help the female. For the male, if the number and the quality of sperms is poor, then for the male, the treatment for that is taking the sperm and directly injecting it into the egg.
You'll get the sperm from the man.
Yes.
So you'll be sorting the speed problem.
Not just speed. It's speed, access, and accuracy. Yes.
So you'll get it from the man.
Yes.
Which means it's of good quality.
The best quality that he can provide at that point in time.
Yes. And then you inject it into the man.
Into the female.
Okay.
Not
into the yes, sorry.
Yes. Yes, and not just into the female, but into the egg.
Okay.
So for instances where, like now, the tubes are blocked, then we put the woman through what is called an IVF cycle, where we give her medications that have hormones to stimulate the eggs to produce the ovaries to produce as many eggs as possible. Then we take her to theater. We do something called ovum retrieval, where we suck out the eggs, and then we take the sperms, join them with the eggs, leave them in an incubator, have them grow to the best of their ability, if it is possible for them to grow and they accept to fertilize, and then take what results, we call that an embryo, and then we take it and then we put it into the lining of the uterus. We call that embryo transfer. Yes.
That's an embryo transfer,
Yes.
which is similar to the IVF.
No, not similar to the IVF. It is the end point of IVF.
Yes.
You know, IVF is in vitro fertilization,
Yes.
by definition, which
Yes.
where we say we are taking the sperm and the egg and having them get fertilized
Yes.
in the lab.
The test tube baby, and then
Yes.
you get back to
Now
the
you
woman.
get, yes, then you
Yes.
put it back inside.
Yes.
So it is not similar to,
Yes.
it is the last
actually-
step
yes.
of the process.
So you have done this,
Yes.
and you get it back. Oh my God, medicine is trying God. So you get it back to the woman's uterus. And I'm thinking that psychologically, this woman did not conceive.
How now?
You just retrieved, you just removed, an ovum.
Conception is conception. Whether it happens
Concep-
inside the body or outside the body, it is still
Yes.
conception.
But don't you need the hormones
Yes.
in the woman's body
Yes.
that make that? That is something that imagine you have gotten the egg from the woman,
Yes.
and then you have fertilized them in a test tube,
Yes.
and then you need to put it back.
Yes.
How are you going to synchronize that?
The relationship between
Yes,
what
so
is
that,
put inside and the
yeah,
mother.
because it feels like it's a lie. It feels like it's a lie. This woman is not actually pregnant. I don't know how do you synchronize?
So we may be simplifying the description of the process, but there's a lot of coordination that is happening.
Okay.
Because by the time you're giving the woman this treatment to stimulate the production of the eggs, the production of the eggs is also tied to the production of hormones in the woman's body. After we have taken those eggs and after we get the sperms and join them, in the meantime, we are also preparing the woman to receive what is growing in the lab. And while that is happening, so she's given hormones to support that. And after the treatment is done, we don't just say, okay, we're done, bye, see you next time. We actually give the patient a series of medications that will offer a lot of support
To tell her body that she's pregnant.
in order to convince the body to accept the pregnancy. Because you remember we talked about the lining of the uterus being the final point of attachment of pregnancy. So if there's a problem within the lining of the uterus, then we have an issue. So we want her body to accept, and the lining of the uterus to accept to have that potential baby attach.
Oh my God. That's why I said medicine is a big trial to God. It's like trying God in a way. You have to put it back.
No, but God gives the knowledge, and when God gives the knowledge and God gives the understanding and makes it possible for us to be able to help.
How different is that from surrogacy?
So surrogacy is a related concept, but now in this case, if we are using, in event that we are sure that the woman should be able to produce eggs and the man should be able to produce his own sperm, then we take them and we join them. And a surrogate is a person who will carry the pregnancy on behalf of the woman. In event that the woman is not able to produce good quality eggs, or the man is not able to produce good quality sperm, we actually have a treatment option for that. So we have sperm donation for the man, and egg donation for the lady. And those are legitimate treatment options. And there are some who say they had problems that necessitated, say, the removal of their uterus.
But you see, this is not their own
eggs.
seed.
It's not biologically theirs.
Yes, because it's donation.
Yes.
So, but surrogacy, I guess, was the man has given his, and for whatever reason, the woman is unable to.
Not necessarily. That is egg donation.
Okay.
The woman
is unable to carry.
Yes. Now
so
that would be
the
surrogacy.
sperm is her husband's.
Not necessarily.
And the egg is hers, but once the formation, the conception has happened, then the woman, for having a weak uterus, for whatever reason, she's unable to carry it to term. So she surrogates, and another woman now carries for her, but the egg is hers, and the sperm is her husband's.
So you're
is that
halfway there.
surrogacy?
You're halfway there.
Okay.
So you're halfway right, with the sense that if it is their own egg and own sperm, fine. That's biologically theirs. But you can also have surrogacy as where you have borrowed eggs or borrowed sperm or both are from someone else, because the surrogacy is not the source of the egg and the sperm. The surrogacy is the carrying of the pregnancy.
Yes.
Yes.
So there will still be, the baby will still be yours.
Yes.
But so your participation will be, you have bought, you have received, you are the ones in charge, and the end product now belongs to you.
We don't call it bought, but we call it commissioned.
All right.
Yes.
Commissioned.
Yes.
Wow.
It's a lot more. It's being involved in the whole process, a lot more than waking up and going to an adoption agency.
Oh wow!
To go and adopt a baby.
I like this discussion, and I like the class. Viewer, we need to take another short break, and then when we come back, we'll be talking about something very interesting, but briefly though. Okay, welcome back, viewer. Dr. Koige, we have spoken a little bit about IVF, just a little bit.
Just a little bit.
We have also touched a little bit on surrogacy.
Yes.
I don't know how common surrogacy is in our country today. I know that we, of course, do IVF. We have heard of cases where people have had successful stories. What is the costs? Where can we find such treatments, and how common do you have? How common is this practice, especially for you, who is an expert?
All right. Thank you for those very important questions. Now, on average, the cost of going through one cycle of IVF is roughly about 500,000 shillings.
One cycle?
Yes.
Okay.
Because you see, treatment is not a guarantee of cure.
Oh, yeah. You may try once and then it doesn't happen.
Exactly.
There's no conception.
Exactly.
Then you try. Okay.
The same way that they've been trying for years,
Yes.
and they kept on trying but not succeeding. The same way that IVF is not a guarantee of success,
once
but
you will.
it significantly improves the chances of success, because treatment is not a guarantee of cure. You can treat a problem, but you cannot offer a guarantee
Yeah.
that you'll be able to definitively resolve it. So assuming that we're using the lady's own eggs and the man's own sperm, then and that we are going to give the egg into the embryo into the woman, then the cost is roughly about 500,000 shillings. Yes. So that is the basic cost around. The cost varies
Yes,
a little bit, but and of course has definitely gone up considerably, because the cost of the medications has gone up. The cost of the equipment has gone up. The cost of the expertise has gone up, because we simplify it, but there's a lot of technical expertise that has to be brought onto the table in order to optimize the chances. And it's actually possible to access these services right here in Nairobi. If you come to the Nairobi Fertility Clinic, you'll be at 4th floor at Nelson Awori Center. You'll be able to access these services there. So it's actually readily available here in Nairobi.
It's readily available at 500,000.
Yes.
Just a quick one before we get to the next thing. How many possible trials can be done now that there's no guarantee that once I do my 500,000, it may not be successful? Yes. How many possible trials, and in a span of how long?
So we don't restrict the number of trials or the duration of trying. It purely depends on the ability to get good quality eggs, good quality sperms, the ability to afford, and the availability of the treatment facilities.
All right.
So we don't put a ceiling. The same way when people have been busy trying, they don't really put a ceiling until they feel it's been too long. Yes.
When you get to surrogacy, the other option or the other means or method of treatment, what would you advise after mentioning that surrogacy is about just the vessel, the person who carries? Would you advise that couples still try to have their own sperm and egg, or they would seek commissioning?
So,
because I'm imagining that for them to get there, the many other things they've tried didn't work. Yes.
So, if in event that a couple is having trouble getting good quality eggs and good quality sperms, it's possible to address that through sperm donation and egg donation. If there have been consistent problems in trying to persuade the woman's body and the uterus to accept to carry the pregnancy, then it is possible to commission a surrogate to carry the pregnancy for her. Yes. So that option is actually available. And I think it's not about how common it is per se. It's that the treatment option is available, and it's not so much about the numbers that are using this treatment, but that it is available and it is availed on the basis of the problem the patient is facing. Because not everybody who will come in would ultimately need a sperm donor or an egg donor or a surrogate. So it depends on what problems the person is facing. For instance, if a woman was having problems that made her have to have her uterus removed, and she still desires pregnancy, she still desires a baby, then the only way that she would be able to get a baby would be if somebody was asked to carry the pregnancy on her behalf. Yes.
There's a lot of stigma. Society is really unkind when it comes to dealing with such people, because people don't know what you have been through in life to get where you are. It may not even be that you are infertile, but you may have gone through a problem like you mentioned, that your uterus had to be removed. How do you get such people to understanding and acceptance, because it feels like infertility is a subject not more of medical but psychological and mental, because even them leaving their space to come to you and tell you, you know what, I'm not able to, even for a man to say that is very difficult. How do you manage to get your clients come to trust you and do what they need to do?
So we actually do a lot of counseling. We take a lot of time to explain. First of all, if you don't understand that there is a problem, then you'll have trouble being able to follow through. If you don't understand where the problem is, what the problem is, how the problem is preventing you from being able to realize your life dream as a couple of being able to have children where and when you want to, then you'll not have the ability to be able to commit to walking the walk and going through the journey of seeking treatment for it. And of course, once the information has been availed, and that is in a space where the necessary resources in terms of skilled labor, the physical facilities, the ability to afford, and the teamwork necessary all come together. Then, when you have that, then we can increase the chances for that couple at that point in time of being able to have their success. Yes.
We are actually coming to the end of our show, and I would like to get from you if there is still another method of treatment other than when you talked about the courses, you were able to expound on matters lifestyle, other than people checking and adjusting their lifestyle and having the IVF and now even the surrogacy. Is there any other method that people would need to do to receive the treatment?
Yes, there are a few other methods. I think those are the most advanced and most complicated. There are a few other methods, like, say, for instance, if the number of sperms is a little bit low, you can raise their numbers and deliver them through intrauterine insemination. But that is usually something that is done a lot earlier before you get to the point of committing to go to the journey of in vitro fertilization or donation or surrogacy.
Which is better? If they can be boosted, I think that will be better than, and maybe less expensive.
Very true. And we do have quite a number of treatments that can help as much as can be medically achieved to try to supplement the number and the quality of the sperms for the male and the quality of the eggs and the ability of the woman to ovulate.
Wow. Yes. I can hear that there is still a lot much more that we haven't been, that we need to talk about, because I can also feel that the viewer has not yet, gotten all their questions answered, and they would rather have a one-on-one with you, because I guess that their problems are so personal that they would rather get a one-on-one with you and explain, and you would answer like directly and what is relevant to who. And so you could probably give us your parting shot and tell us where they can find you and what your contacts are. And please also, because of this season, don't forget to give us some Christmas message.
All right.
Go ahead.
So I'll start off with the Christmas message. First of all, happy holidays. Remember that Jesus is the reason for the season. And my parting shot in relation to today's subject of infertility and infertility care, it is very possible to provide legitimate treatment options, and the possibility of having a good outcome and the highest chances of succeeding are made possible when the man and the woman come together as early as possible and seek medical care. And for those who would like to reach out for individual consultations, I am readily available. You can WhatsApp me or call me directly on 0719 662202. And you can also find me on Instagram, and my handle is at Dr._Paul_Koigi, and my Facebook page at Dr. Paul Koigi, and also on LinkedIn at Dr. Paul Koigi.
Wow. Awesome. Thank you so much. Thank you so much, Dr. Paul.
Thank you, Betty.
It was a pleasure to host you. You have taught us a lot of medical issues we did not know. I am so grateful to host you and even to learn about those infertility matters that are not there in the public.
I'm happy to be of service. And the conversation should not end here. I believe let this be the starting point.
All right.
And let's have more opportunities to be able to sit and talk more, because there is a lot more
Definitely.
to share. And let's empower the public to have the right knowledge in order to enable them to make the right decisions to have the best possible reproductive health outcomes.
Awesome. Thank you. Thank you so much, viewer, for being part of this show. I am so grateful that you watched, and I'm hopeful also that you have gotten a lot of information that you needed. Please take up the right route and just do what the doctor instructs. Sometimes we try so much, but we still failed because we are not trying the right thing. We have the right information. Let's do this together. My name is Betty. I've been your host. See you next time.